Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So let's quickly review medicine case studies as well. So I have taken two repeated questions. One question is regarding infusion and one is regarding vaccination. So let's review the guideline and the question. Let's see our first case study, which is regarding outpatient infusion and IV push with hydration. Patient diagnosed with a bacterial enteritis and dehydration, admitted to the outpatient department of the provider, initiates an IV infusion of Levaquin over 2 hours. In addition, the provider administered two IV push medication. One is Demerol and Reglan. After completing this treatment, the nurse contacts the provider because patient develops low blood pressure and reduced urine output. In response, the provider orders 3 additional hours of IV infusions of Ringer's lactate for hydration. Okay, so here they have performed IV infusion and IV push and then hydration. Okay, so 3 different procedures they have performed. When you see multiple procedures are performed in a single medical record, you have to follow the hierarchy. Okay, so hierarchy you can see the severe one is infusion and next one is IV push and after that diagnostic injections and later hydration. Okay, so accordingly you need to select your primary code. Remember, when you are coding for infusions or IV push, the thing is we can code only one primary code and you cannot use two standalone codes together. Okay, you cannot take IV push standalone code, that is primary code, and IV infusion primary code, and you cannot bill together in a single scenario. Okay, you need to prioritize one primary code which is having the initial procedure, okay, the severe one, and later following hierarchy you need to select the add-on code from the particular procedure. Say for example they have performed infusion in the initially, so for infusion you will code the primary code and for IV push you will take the add-on code, and to report the hydration again you will use the add-on code. Okay, so make sure you are coding only one primary code, remaining should be add-on codes. Okay, so here you can read the question one more time. So the provider initiates an IV infusion of Levaquin over 2 hours. So infusion, therapeutic infusions, they have did for 2 hours, and then he also administers IV push medication. So you have to check when we are talking about IV push, you need to check is it same substance, that is it same drug or a different drug. So here they have taken two different drug. Okay, and again coming to hydration, hydration also performs additional 3 hours. So please, you have to be aware, for hydration you need a minimum time requirement of 31 minutes to code the hydration code. Okay, and again when we talk about IV infusions, for infusions we need minimum 16 minutes. Okay, 16 minutes as a minimum time requirement. So first hour you can bill up to 16 to 90 minutes, one code you can utilize, and same way for hydration also 31 to 90 minutes, one primary code you can use. More than 91, like if you get 91 minutes, then again you may have to use an add-on code, because after 60 minutes if you are additionally getting 31 minutes, then you are supposed to take one more add-on code. Okay, so that is the concept. So you can check the hierarchy here and check this option. So I'll explain all of this with a description of the code. Let's find the answer. So check this code description. So I will just give you a brief idea about what is what. So firstly, hydration 96360 is a primary code and 96361 is an add-on code. 96360 you will code for hydration if you meet 31 minutes to 1 hour. Okay, even if you are getting 30 minutes, you cannot use 96360. Instead, you have to utilize the injection code. But here if you meet 31 minutes, then you can go with 96360. And additionally, when you will utilize additional code 96367, it is for intravenous infusion hydration each additional hour. That means, to give you an example, say for example, you are having 91 minutes total hydration. Okay, so in this 91-minute criteria, you can use 963601 primary code and 96361 one add-on code, because you are getting 60 plus 31 minutes. Okay, so you can utilize the add-on code when you get the 91 minutes. So if I mention only 90 minutes, okay, in this case, you cannot use 96361 because additionally you are getting only 30 minutes. Okay, so this you should be very clear. And this is an again hydration set. And next you can see intravenous infusion code set. 96365 is a primary code and this takes up to 1 hour, and 96366 add-on code. Okay, each additional hour, and again one more add-on code is there, 96367, and 96368 is there, that is for concurrent infusion. Coming to IV push 96374. So here we don't need any time requirement. Okay, so start time and stop time is not required to code IV push. So you can go with 96374 when you don't have any time criteria. And also 96375 is an add-on code and we will utilize only when you have a different or a new drug. Okay, if they are introducing or if they are administering any new substance, then you can take 96375. Same way 96376 is same substance. If they are administering Zofran for the initial hour and next hour also they are giving Zofran only, at that time you have to code 96376. Okay, this is for same substance. You can see same substance. So now coming back to our question. So as they started the initial breakdown, the question was saying 2 hours of IV infusion, okay, of Levaquin. So then infusion, intravenous infusion 96365 will be your primary code and it is a severe one. According to hierarchy also, you need to prioritize IV infusion codes as primary code. So I have to code 96365 for 1 hour. Okay. And additionally, I have to code 96366 for one more additional hour. And then what I have to do? I have to go and check my IV push. IV push codes they have given with the two different drugs. One is Demerol and one is one more drug. Okay, so the new substance code, additionally I have to use an add-on code 96375 with units 2 because two different drug they have administered. So we are done with IV push also. Lastly, patient got dehydrated, so they have did a 3 hours of hydration procedure. So in this hydration, you cannot code the primary code. Instead, you have to code your add-on code 96361. 3 hours means with unit 3. Okay, so answer is, you can check, answer B is correct. 96365, 96366, 96375 with units 2, 96361 with units 3. Okay, so please go back and check your coding guidelines and check the code description in the CPT book. And if you still have any doubts, please do comment. It's easy if you understand the coding guideline. Okay, so let's see one more question. So this question is about immunization. A 4-year-old child visit a pediatrician for a routine immunization. Provider administered the following vaccine: MMR, DTaP, and varicella. So total 3 vaccines are they have performed. So you should know the coding guidelines for when you are talking about the immunization. You should know the coding guideline for what to follow as an admin code and how to code for a product. Okay, admin code is a route of administration and product is what are the vaccine they have given, that vaccine code you have to give. So you need 2 codes here. So first administration code selection, we have a coding guidelines. So check the patient age. Patient age is 4 years and Also, provider administers the vaccine. So when we are talking about less than 18 year, then you need to check the coding guideline. So let's see the coding guidelines and we'll discuss about this particular question. So when you are dealing with immunization, the first coding point you have to check is what is the patient age. Is the patient is below 18 year or above 18 year? Okay, say for example patient age is less than 18. In this case, you need to check one more coding point about counseling. Counseling is present or not? If counseling is present, then your admin code is 90460 and the add-on code is 90461. So if you see in the bracket, they are saying 90460 as for initial first component, 90461 is each additional component. And same thing, patient age is less than 18 year, but they did not provide with like any counseling. It goes with without counseling. So usually what will happen, if provider giving vaccine, he will generally provide the counseling. If nurse or any physician partners are giving the vaccine, means they don't give any counseling. So you have to mandatorily you have to check counseling is present or not. So if counseling is not there, even though patient age is less than 18, you have to select your 90471 as your admin code, that is your primary code. And additionally, if any vaccines are additionally given, then you can utilize add-on code 90472. And for this 90471, what are the route of administration? If it is administered through intramuscular, subdermal and subcutaneous, you can choose 90471 and 472. Same way, if route of administration is oral or nasal, you can choose 90473 for the first vaccine and additionally you can utilize 90474. Okay, so these are the things that you should consider. And now if patient is above 18, you don't have to check counseling is there or not. Directly you can just check the route of administration, intramuscular, subdermal or subcutaneous or oral or nasal. Based on that, you can select your admin code. Okay, 90471 for intramuscular, subdermal and subcutaneous and 90473 if it is through oral or nasal. Okay, so now identify one difference here. 90460 they are saying first component and 90471 they are talking as a first vaccine. Okay, so you should know the difference between when to consider based on a vaccine or when to consider based on the component. So now if I mention MMR vaccine, okay, so together this we will consider it as a single vaccine. I will say MMR vaccine. So if I want to know about its component, then I need to split this vaccine. Okay, so MMR means there is a component for mumps, measles and rubella. So three different components are present in a single vaccine. Okay, so when the patient age is less than 18 and provider did counseling also and your admin code you are going to bill 90460 means you need to code based on the components, not based on the vaccine. Okay, so in our question, patient age is only 4 years and they had given counseling also. So our admin code should be 90460. So how many vaccine they have given? They have given three different vaccine, MMR, DTaP and varicella. Okay, three different vaccine they have given. So as I said, when you are coding for 90460, you need to split each vaccine. So let's split the vaccine. In the first vaccine, we have three different components as I mentioned. One component as mumps, measles, rubella. So each of the vaccine first component. Okay, each vaccine first component you can take units with the primary code, primary administration code. So first 1, 2, 3. All of these three initial components, I am going to give units to my primary code 90460 with units 3. Okay, so now in our first vaccine, how many components left out? So my mumps and rubella left out. So 2 components left out in the initial vaccine. And in the second vaccine, that is D tab, it says diphtheria, tetanus and acellular pertussis. So I have again left out with tetanus and pertussis. So again two components are left out here. Diphtheria I have already taken with my primary code. I am only talking about the additional ones, that is tetanus and pertussis. And in the varicella, we don't have any additional components left out. Whatever the single component is there, that we already taken with our primary code. Okay, is it clear? So now what I have to do? I have to utilize my add-on code 90461. And how many components left out? In my first vaccine, 2 components left out. And in my second vaccine, again 2 components left out. Together, I have 4 components. So I will give units with the 4 units with my add-on code. And then we are done with our administration code selection, because we are still coding for administration. So now I have to code for each product, each vaccine. They have whatever they have given, that vaccine code also I have to give. 90707 for MMR, and 90700 and 90716, this is for varicella, and I think 90700 is MMR, 90707 is DTaP. Okay, so check the code description. All 3 vaccine you need to code it, and then later Z23, it is encounter for immunization. You can use this code. Okay, so together we have to code like this when you are coding for patient ages less than 18 and with counseling. Okay, so if you have not understood this clearly, please mention your doubt in the comment and I'll try to solve the doubt. Okay, so since we have presenting with the PPT, I cannot really go back to book and show what is the code description, and I can't even add all the complete information here. So I tried my best to explain in a simple way. If you have not understood, please let me know. And yes, so the answer for this particular question is option A. Okay, so that's all guys. And if you are getting question like based on above 18 year, how to code means, you don't have to go by component, you just have to go by your admin code and directly vaccine. Okay, can I reframe this question? Like if same question MMR, DTaP and varicella, but patient age is 25-year-old means, what you will do, you will count the vaccine. There are 3 vaccine here, 1, 2, 3. So for 3 vaccine, what you will do, your admin code is 90471, and additionally how many vaccines you got, DTaP and varicella. So 90472 with units 2. Okay, so add-on code units 2 you can give, and again vaccine code for vaccine MMR, and again DTaP and varicella. Okay, so you have to code both administration and the vaccine code also. Okay, but you don't have to split when you are coding for 90471. So 90471, it is only the route of administration you should check, intramuscular, subdermal, subcutaneous. Okay, if they give or if they administer through oral or nasal, then your admin code is 90473, your add-on code is 90474. Okay, so this is an advanced level. If you are completely new to vaccination or immunization topic means, you may find little hard to understand. But since I am focusing on CPC exam preparation, I am just hoping that whoever viewing this or whoever daily following my page, maybe you all are preparing for exam. Okay, so I am just going with a real-time scenario rather than explaining so much about basic things. Okay, so that's all guys. Thank you for watching this video, and if you like the video, or if you find it useful, please do subscribe to my channel and please do share with your medical coding friends. Thank you.